Hello, everyone. We are on Chapter 12, which is Care Routines as Context for Joy and Learning. At this point in the semester, everything we've learned and gone over begins to connect and sometimes overlap. We've discussed care routines as a rich opportunity for learning, and this week we'll go a little deeper into the subject. We know that the relationship between infant and caregiver is so important and is truly the foundation and basic building block for all other development. The way that we care for infants shapes their lens of the world and is the very first curriculum. The following quote by Emmy Pickler describes so perfectly the importance of how we are with babies. What a different picture of the world an infant receives when quiet, patient, careful yet secure, and resolute hands take care of her. And how different the world seems when these hands are impatient, rough or hasty, unquiet, and nervous. This just really emphasizes that how we are with infants is even more important than what we do. And again, the social curriculum comes first. We know that relationships are so important that they actually shape the developing brain. We also know that infants are born with an incomplete brain, and that after birth through age 3, the brain develops so rapidly. These are such impressionable years. The relationships and the way in which infants are cared for, the way we are with babies, affects brain development and what the infant will come to expect. Remember the saying, neurons that fire together, wire together? The more an experience occurs, the stronger the connection between neurons becomes, essentially holding an experience in the brain. And therefore, relationships actually get built into the brain, so to speak. How we are with babies impacts how they come to know the world. Care routines are such a wonderful opportunity to provide a positive experience, memory, and expectation of who they are in relationship to the world around them. Think of care routines as a piece of clothing. You want it to be comfortable, neither too loose nor too tight. You want to feel good when you're wearing it. Routines of care are a significant part of the day, and if approached appropriately, can and should be pleasant and comfortable. Care routines are also opportunity for one-on-one care that may not be possible in other contexts. And trust me, I understand that sometimes it's not possible to have the one-on-one time, even through the care routines. But if possible, it's a time for undivided attention and participation from the infant. Diapering, dressing, meals, naps, arrivals, and departures are all examples of care that invite infant participation. We can invite infants to participate by offering a gentle touch, establishing eye contact, using language or gesture to indicate what you are about to do, and pause to give a moment for the infant to respond. Our text gives examples of what we can do and language we can use to encourage participation through routines. The important piece is to view the routine as a learning opportunity and to engage in the process with the infant. Rather than rushing through the routine to complete it and move on to the next, embrace the moments within the routine. Mary Jane McGuire Fong says, "When we engage with the babies rather than act on them, we give the chance to build skills and concepts and to make sense of language." Meals are a perfect opportunity for learning. Between the ages of 0 to 3, mealtime changes quite a bit. From being breastfed or bottle-fed, to eating pureed foods, to solid foods, and feeding themselves. For young infants, there are some approaches that can set up respectful meals, always holding an infant when they are being fed, whether it be breast or bottle. Comfortable seating for the nursing mother or those offering a baby a bottle is important. If offering a bottle, hold it so that the infant can see it first and anticipate what is about to happen. Until the infant can sit up on their own, they should always be held when fed. When they're ready for pureed foods at around 6 months, they may not be able to sit on their own yet. Only once they can sit on their own should they be placed in a seat, ideally a low chair with sides. In this situation, the caregiver should be at eye level, This way they can catch each other's gaze and the caregiver can easily offer the spoon. One way to do this is to hold the spoon at the infant's eye level so they can see it. Most of the time they will open their mouth. Toddlers take on a new role of deciding what and how much they eat. Typically around a year this transition happens, and at this point the caregiver can prepare and offer the food while the toddler decides how much and what to eat. This can be supported by providing clear measuring cups as pitchers, allowing them to serve themselves in a family-style meal, and encouraging them to eat without pressuring them to eat. If the service area is adjacent to the caregiver, they have easier access, which minimizes distractions. And always expect spills and have a cloth close by. Can you see any of what was just covered in this picture of a toddler mealtime? How, what, and when infants and toddlers are fed are influenced by development, but also culture. Reflect on this scenario and think about how you could acknowledge, ask, and potentially adapt in order to hear and understand differing cultural perspectives. The mother of a toddler is upset by the mess she sees when she discovers you are letting him feed himself. She asks you to spoon feed her child like she does at home so he eats more, doesn't get messy, and less food is wasted. What are some of the contrasting views regarding values, beliefs, and practices? What would you say to acknowledge, ask, and adapt in this situation? Diapering is another excellent opportunity to engage, encourage participation, and support development. To do this, you can greet the child, let them know what you are about to do by saying and demonstrating it, wait for their reaction and response, and then gesture for participation. Even with the youngest infants, we can do this by using self-talk to describe what is going to happen and parallel talk to describe what the infant is doing. For example, when you're approaching a young infant, you could say, "I'm going to change your diaper now. Can I pick you up? Here we go over to the changing table where I will lay you down. Now I'm going to take off your diaper and put on a new one. You're smiling. Are you feeling happy?" For older infants and toddlers, this example would look much different, but still, the language is a key piece in the routine of diapering. Again, we have another scenario regarding diapering and the cultural context. A parent who has just enrolled her infant in your infant center explains to you that her 9-month-old crawler is toilet trained and insists you leave off the diaper while he is playing at the infant care center. What are some of the contrasting perspectives in values, beliefs, and practices regarding this scenario? And what would you say to acknowledge, to ask, which might lead to adapt? Moving on to napping. Although napping areas will look different depending on the shape and size of the room, it should be a quiet area away from active play. Depending on the age and temperament of the child, their cues and patterns will look different. Getting in tune and familiar with how they express their readiness for sleep, as well as what is practiced at home around sleep schedules and nap time, is important. Despite these differences, a calm and predictable routine should be established so that the infant or toddler know what to expect and feel comfortable, safe, and secure. We've covered mealtime, diapering, and napping routines as contexts for joy and learning. Reflect on how arrivals and departures can also be viewed and approached in the same way. If we can see routines in this light, we can slow down and focus on the process rather than the outcome, inviting participation, engagement, and language enrich the experience for both the infant and the caregiver. Remember, how we are with babies is more important than what we do.